Fantastic. Again, my name is Erica Sugimori. I'm the HIV Services Manager with the Louisiana Department of Health Office of Public Health STD HIV Hepatitis Program. We are happy to present to you the results of the most recent statewide needs assessment for people living with HIV. This collaborative effort is conducted every other year to collect information on service needs, barriers, and gaps among people living with HIV. The data is regularly utilized by planning committees throughout the state that work on continuing to evolve the HIV care landscape in Louisiana to provide a comprehensive continuum of HIV care throughout the state. We hope this information presented to you today is useful in your ongoing planning and use. In terms of housekeeping, we're going to be taking questions throughout the presentation, and Brandy and I will be paying attention to the chat. And I see a hand up that went away. Okay, great. So we'll do our best to pay close attention to the chats and people coming into the meeting. We thank you again for your time today, and I will pass the mic over to our wonderful folks at the Policy and Research Group. Thanks again.
Thank you so much, Erica. All right, I'm going to go ahead and share my screen. Bear with me, just want to make sure. There we go. Here we have one, and then I'll go ahead and. All right, so everyone should see the first slide in the PowerPoint. Yes. All right. And then I believe Brandy put a link or some of the slides in the chat as well, if anyone wants to follow along, or if we go past the slide and you want to further look at it as well. But I'll go ahead and get started. I know some more people are still entering, but I think we can still follow along as well. So hello, I am Alexis, and my colleague Noor is on as well. We work for the for the Policy and Research Group, and we are here to present the results from the 2021 Louisiana Needs Assessment for people living with HIV. Before I begin, I just wanted to acknowledge that I think everyone here knows it's been a pretty difficult time with COVID and just the state of the world, but it's been so amazing to see the amount of work that people across the board through agencies and different partners have really put in the effort to gather this data and make the needs assessment a priority in making this project possible in order to get the data that will assist so many people. So before I begin, I just wanted to acknowledge and thank all of our different partners and agencies. This was a huge lift, and it was
Erica,
amazing.
can you hear me?
Yes, Jessica.
I'm sorry, Jessica. I can hear you. Hello? Okay, can't hear you now. Go ahead, Alexis.
Okay, all good. Can everyone hear me? I think. Okay.
You sound great, Alexis.
All right, sounds good. So I'm just going to start off with a little roadmap for our presentation today. So it's all divided into different parts. And at the end of each section, we're going to have time for questions or discussion on that specific section. If you find that you don't have questions, or if you don't have questions but want to talk through the findings instead, that is great as well. We want this to be a time for open dialogue about findings, since we're all online at once, and we want this presentation for y'all to get the most out of it. So please feel free to share thoughts as well as questions. And at the end, we're hoping that we'll have time for a general Q&A and discussion in case your question or discussion point doesn't fit well in any of these sections. I also wanted to acknowledge that we do present a lot on the slides, but we just have a lot of information that we want to go over with you all. So if we get to something and it looks a little overwhelming, don't worry, Nora and I will explain it. So first off, the introduction. Who are we? We are the Policy and Research Group. We are an independent research firm based in New Orleans, and we have another office in Seattle and staff across the USA. We partner with OPH every 2 years to help administer the statewide needs assessment for people living with HIV. And our office has been teaming up with OPH for the needs assessment since 2008. So we're really familiar with the process and love working with OPH and helping you all. And we're really excited to be here today. So first, we're just going to start with a little general overview of the process of the needs assessment before diving in to the results. So I know most of you all are really familiar with the process, but I just want to make sure we're all on the same page on how it works. So what's the purpose of the Louisiana Needs Assessment? So we aim to gain an understanding of current care service needs of people living with HIV in Louisiana. We want to estimate their unmet primary care needs as well as their HIV-related support service needs. We want to understand people living with HIV's experience in accessing services, their perceived barriers to those services, and knowledge of different services. So here I have just a bird's eye view of how the process works. So we team up with different state-funded agencies that specialize in serving people living with HIV to survey this population. All questionnaires are submitted to us, PRG, for data entry, cleaning, and analysis. After analysis, we create 3 reports based on the regional results and then a combined statewide report. These reports are used to help allocate fundings and resources to where they are needed the most. Looking at the survey administration. So this is how clients access and take the survey. It is all agency-based, and we cannot do any of this without our partners. The questionnaire is completely optional and offered to clients when they come into the agencies. Prior to data collection at these locations, they receive special training about promoting and administering the needs assessment. Clients can opt out of taking the survey if they don't want to take it, and it does not represent the entire people living with HIV population of Louisiana, but rather a subset of those in care and opted into taking the survey. We offered an electronic version this year, which is a new addition to the normal paper version that is normally offered. And every client who completed the survey received a gift card as a token of appreciation. These are the many different healthcare agencies who helped to administer the questionnaire, and we're thankful to each and every one. So this year, agencies face many unique challenges with administration. With COVID, many agencies face fewer people coming into the clinic due to fear of the virus, as well as social distancing concerns. Many doctors and case managers were just seeing fewer clients than in years past. So to help alleviate some of these issues, PRG and OPH prioritized an electronic version of the survey so agencies could email out the link to patients or provide the link at telehealth appointments to try to get around social distancing and access the full set of clients. Another COVID-related issue was supply chain delays in getting clinics their gift cards to give out to clients. Many agencies did not feel comfortable data collecting without the gift cards in hand. Throughout data collection, OPH and PRG were in regular communications with agencies to help raise response rates through weekly reminder emails, as well as extending the data collection window when appropriate. The New Orleans region in particular also faced setbacks related to Hurricane Ida, making landfall a few days before data collection was set to start. Their window was delayed by a month, but many clients and agency employees were battling different priorities with mental health issues, FEMA claims, and widespread evacuations. Lastly, after living through a pandemic, we found that agency employees and clients are very tired. OPH anticipated this fact going in and made the incentive larger than in years past. And here I have a table of the breakdown of number of people living with HIV in each region of Louisiana on the left, and then how it compares to the number of surveys collected in each region on the right. So as you can see, some regions are overrepresented and some regions are underrepresented. So circled items highlight, for example, Baton Rouge represents 23% of people living with HIV in the state, but for the sample size for the needs assessment, they're actually closer to 29%. And alternatively, region 9 is 7% of people living with HIV in the state, but only 3% of the samples. And I know we obviously had many challenges this year, but in 2019, we had a total of 1,949 surveys. So despite all of these challenges, the agencies overall did a better job than last administration, and we gathered 72 more surveys. Here's just a map of the residents of where respondents live. So the darker the blue, the more people responded in that parish. And then the lighter the blue, the less people responded. So you just see a little overview of state representation in the sample. So as mentioned, we had the electronic administration this year to alleviate some issues with COVID. Clients could more easily complete the survey on their own time. So PRG, we provided materials, both posters and smaller take-home cards for clinics containing the QR codes and the short link that could be used to access the survey. We are looking next year at having the electronic version be both in Spanish and English, so clients can just choose which language they're more comfortable with on the first page of the survey. And from a data cleaning perspective, surveys that are collected electronically are cleaner to analyze since we don't have to put them into our survey system, and they take a shorter amount of time for clients since they will automatically be skipped out of questions that don't apply to them. And then I just wanted to highlight that this year, even with the first rollout of the electronic administration, we did receive 1/3 of all surveys submitted were via electronic submission. And here we have the percentage for each type, so either paper or electronic, of the collected surveys. So overall, the numbers do show that paper surveys are still more popular at 67% total collected on paper. But we do see that a few regions were primarily used electronic data collection methods. I have circled those that are actually the majority completed online, and that is 3 out of the 9 regions this year. Do we have any questions or comments on the process before moving forward to the actual results?
And while Erica and I are watching for people's hands, I just want to remind people, write down your questions and comments in each section. And I do see Madison's hand. And as you've noticed, as we get to the end of each section, as we said, we'll take questions and comments then. So the mic is yours, Madison. Once you unmute yourself.
Hi, I was just wondering, you said you wanted to do the electronic survey in both Spanish and English. Was the paper version available in Spanish?
It was this year.
Thank you.
Yeah, I think we had about 3 Spanish surveys submitted, but I believe that it was a few months after the administration started that we had them available. Any other questions? All right, I will pass the baton on to Nora to talk through some of the statewide results.
Great, thanks, Alexis. So in this section, we're going to be presenting results from the statewide report, and then later on, we'll have separate sections that present findings specific for New Orleans and Baton Rouge. And for the purpose of this presentation, we're just going to be highlighting the top 4 or 5 categories that were selected for most of the figures that we show. But the full comprehensive figures are going to be found in the report themselves, and we'll have the finalized versions out to you all by the end of this month. So starting with background characteristics. So this table represents demographic characteristics of the people surveyed for the 2021 needs assessment. And overall, the population surveyed looks like what we would expect. The majority identified as male, Black, and as older adults, with the majority being between 45 and 64 years of age. And in terms of educational attainment, the majority reported having a high school diploma or less. And I'll pass it back to Alexis to discuss questions related to HIV-specific information and care.
Thanks, Nora. Yeah, I'm just going to go through some graphics and questions related to HIV-specific information and care. First up, we have the length of time respondents have been living with HIV. As you can see, answers are pretty spread out among the categories. The majority fall within 5 to 9 years and 10 to 14 years, but all categories are pretty well represented. Here we have another way of looking at that same figure. It's a pie chart and with a fewer categories. So the largest light blue chunk represent clients living with HIV for 15 years or more. This lighter blue chunk of 38% represents those living with HIV from 5 to 14 years. And then this darkest blue, 18%, is clients who have lived with HIV for 4 years or less. So as you can see, almost a half of respondents have been living with HIV for 15 years or more. Next, we asked the place respondents were told of their HIV diagnosis. You can see that over half, 57%, were told of their HIV diagnosis in the hospital or ER or at the local healthcare center or STD clinic. Respondents were also asked where they received their sources for HIV information. Responses show that the sources of information are primarily from healthcare professionals. We see doctors or nurses at 84%, and then case managers at 43%. Here we have the places respondents receive medical care. The top categories include community health center and the community clinic. And this probably represents the places respondents receive their chance to respond to the needs assessment survey. So I think that this graphic in particular makes a lot of sense. And then respondents were asked how many HIV-related medical care visits they had been to in the past 12 months. So close to half, 49%, have had 3 or more HIV-related medical care visits in the past year, and less than 10% had no HIV-related medical care visits in the past year. We asked the same question in 2019 and found that respondents to the 2019 survey had been to 3 or more doctor's visits in the past year at a higher percentage than the 2021 sample. In 2019, 62% of respondents had been to an HIV-related medical care visit 3 or more times in the past year. And this obviously has many factors and it might be related to COVID-19, but I did just want to highlight that change. This figure shows how difficult respondents found paying for their HIV-related healthcare costs. And you can see 2 ends of the spectrum. Over half, 58%, found it not difficult at all, but over 10% found it completely impossible. Reading the graphic, we can also see that about 40% of respondents found it at least a little bit difficult. Respondents were asked to select any topics they had received information on in the past year, anything related to HIV transmission and related issues. So from this figure, we can see that U equals U and the importance of going to doctor care visits and the importance of taking medication are the top 3 categories. And we know that U equals U has been an important campaign run by OPH, and we can see that these important topics are being discussed with respondents. Looking specifically at U equals U, we do ask clients point blank if they know what that means. And we found that 78% of clients did know what that meant. We know that OPH has been working on this campaign, and when looking at 2019, there were 58% of respondents from that sample size who knew that U equals U, suggesting that the campaign has been more widespread and reached more people in the past few years. Respondents were also asked the number of days in the past 3 days that they had not taken their full HIV medication regimen. So close to 80% of respondents had not missed their HIV medication regimen, and around 20% of respondents had missed at least 1 day of their HIV regimen. When asked for the reasons for not taking HIV medications in the past 12 months, clients could select any barriers that applied to them that they had experienced in the past year. Almost 60% of respondents selected none of these. I have taken my HIV medications as prescribed for the past 12 months. And the top categories for barriers reported are I have trouble remembering to take them, and the pharmacy did not fill my prescription. Clients were also asked what their current viral load is. So we changed these questions from previous years, which asked clients to estimate their viral load. So this year we did include the U equals U language. So that was a bit of an update. And from this graphic, we see that 73% of respondents knew that their current viral load was undetectable on the day of the survey. And now I'll pass it back to Noor.
Great. So in this section, we're going to be discussing how this year's surveyed clients responded to questions about their medical care. And we'll start off with questions about insurance and healthcare coverage. The good news that you can see on this slide is that the vast majority of respondents report having some type of health insurance. When asked about the sources of their health insurance coverage for general health care, so we're not just asking about HIV-related care here, Medicaid was predominantly selected, with Medicare being the second most selected sources. We also asked people to tell us about problems they had with health insurance coverage in the past 12 months, and the responses most selected were paying for HIV-related care, followed by paying bills. either for dental or vision services or for ER visits or hospitalization. Here we have what clients reported their health insurance coverage covers, with HIV-related medical care being the top category at 83%, followed by HIV-related medication at 70%. The needs assessment also collects data on methods of payment for insurance premiums. More than a third selected LAHAP, and slightly less than a third reported that they have no premium because they have Medicaid. We also asked people to let us know about how they paid for HIV-related medical care, which is shown here on the left of the slide in the figure, as well as their HIV-related medications, which is presented on the right-hand side of the slide. As you can see, the same top 5 methods were reported in the same order, and they're pretty similar breakdowns of responses, with roughly half selecting Medicaid as how they paid for both care and medications, and roughly a quarter selecting Medicare. We also asked respondents to tell us about their 12-month treatment history and whether they were diagnosed, needed treatment, and received it. So I know this is a really busy figure, but what it presents is the frequency of each medical diagnosis. And we've sorted it here so that the most selected diagnosed condition is at the top with hypertension. And if you look at each bar, so just looking at hypertension as an example, you'll see that the light blue presents people who were diagnosed but didn't need treatment. That middle blue color are those who needed treatment and received it. And then that dark blue all the way to the right, those are people who needed treatment but didn't receive it. You can think of those as gaps in services. In terms of frequency, the highest count of those that needed and didn't receive services can be found for arthritis. And just comparing the top 2 diagnosed conditions in 2021 to those in 2019, you had 132 individuals who needed but didn't receive hypertension medical treatment, and 111 individuals who needed but didn't receive high cholesterol medical treatment. So there seems to be a reduction in the counts of people who needed but didn't receive treatment for the top 2 categories presented here. When we asked people to tell us about reasons they didn't receive needed medical care, worried about COVID-19 was the top 3 reason, with 11% of respondents selecting this as a reason for not receiving medical care. And on the next slide, you have a very similar figure to what we saw earlier, but now we're looking at mental health diagnoses, with depression and anxiety or panic disorder being the top 2 most reported diagnoses. In terms of gaps in services, counts are pretty comparable to what we saw in 2019, with 101 people then selecting that they needed but didn't receive care for depression. The reasons for not receiving mental health care, though, look a little bit different than what we saw for medical care. Here, the most reported reason is that people didn't know where to go to receive their services.
Thank you, Nor. So I'm going to take the mic back and just go through some figures on health and health behaviors. So here is just a snapshot of respondents' overall health. So how clients reported how they are feeling the day of the survey, along with self-reported depressive symptoms over the last 2 weeks. So looking at the figure, you can see that over 90% of respondents were feeling at least average or better the day that they took the survey. Looking at depressive symptoms, around 32% report feeling depressed, feeling down, depressed, or hopeless, and 30% reported little interest or pleasure in doing things. In 2019, we asked these same self-reported depressive symptoms and found that the self-reported depressive symptoms were reported at higher rates than what we have from the 2021 sample, with 38 and 37% respectively for that sample size. Respondents were also asked to report any substance they used in the past year. A little less than half had used tobacco or nicotine, and tied for second at 36% were responses for alcohol, and I haven't used any of these in the past 12 months. Lastly, for health and health behaviors, respondents were asked what psychosocial support they would be interested in receiving. This year, we added in high school education or GED programs for this administration. Top categories for this question show that respondents are interested in counseling and support groups, with 40 and 36% of respondents selecting those categories.
So considering all of the challenges over the last few years, we wanted to gather data and look up information in this section on how the COVID-19 pandemic might have affected people's lives and care. About 20% of respondents reported that they'd been diagnosed with COVID-19 in the past 12 months prior to taking the survey. And when we asked people about how COVID-19 might have affected their ability to work, most respondents said that it didn't impact their ability to work in the past 12 months. But it's also important to note that these data were collected at the end of 2021, the beginning of 2022. So these responses might have looked different if we had collected them in 2020. We know that there's a lot of interest around telehealth and how that's both being utilized and received by patients. Here you can see that more than half of respondents reported having HIV-related medical care visits via telehealth within the last 12 months. So that is the section on medical care. We just wanted to open it up to you all and see if there were any questions or comments on the section of the needs assessment. And invite Eric and Brandy if you had any comments and thoughts as well.
I'm watching for people to raise hands or to unmute themselves. I'm also watching for questions or comments in the chat box. Any reflections on any of the data that you all have just seen? Any surprises? Any head scratchers? Any things you want to know more about? Because if you're all quiet, oh, Elizabeth, go ahead.
Hi, thank you, Brandy. I wanted to ask if there was any data related to living with HIV during pregnancy or any patients who may have had experiences with OBGYNs during pregnancy while living with HIV. I know perinatal HIV is a very niche area of HIV prevention, but it's also extremely important.
Yeah, absolutely. That's a great question. We did not have any questions related to prenatal services, but we can definitely look at that in the future. I think we had some questions on at some point, like one iteration, but I think there was just like so few responses that they were phased out, if my memory serves me correctly.
Okay, thank you. And then the other question that I had was, I noticed on the medical diagnoses question, looking for comorbidities, that syphilis was not included. Was there a reason why that was left off due to the, we see a high rate of co-infection between those living with HIV and syphilis?
Yeah, that's a great question, Elizabeth, and it's nice to hear your voice. We do, I think part of the challenge around designing this instrument is there's a lot of data to be gathered. And so in terms of putting together this instrument, we went through a bit of an intensive process in the beginning, trying to gather feedback from many different stakeholders to get their perceptions of what was the most integral to add to this particular needs assessment. But I think the notes that you have today and anything you all are thinking, we're always willing to hear these suggestions, think about them, and we'll note them all for the future needs assessment. And Brandy, I didn't know if you wanted to speak to that process at all.
Just to reiterate that point, those are both excellent questions. We're making notes. And so all of your comments and questions today can help to inform the next version of the survey design and collection process. Thank you, Elizabeth.
That
and that was
great. I was interested in the question, where did you receive your diagnosis? And I know hospital, emergency rooms, STDs. And I wondered if community-based organizations was on there and nobody selected it, or was it not on the survey?
That's a great question as well, Shirley. I'm checking that slide as the ladies are as well. As I recall, I'm thinking it probably was included in the survey response and that it may not have been one of the highest. It does say HIV specific CBO at 14%. So that was the fourth most frequently selected response.
Thank you. I thought it was odd that it wasn't mentioned. So thank you for that clarification.
Absolutely. Great question as well. Thank you. And other questions or comments? When everybody's quiet, I'll pass the mic back to Alexis and Nor.
All right, I will go ahead and keep going. So next up, we're going to just focus on housing. We know that this is always a really important topic for resources and care for this population. So we just wanted to spend a little extra time on these particular findings. So simple enough, we asked clients where they were living at the time of the survey. So looking at the figure, you can see that rented or owned apartments, houses, or trailers rank the highest at 77 total percentage of respondents choosing these answer stems. These suggest slightly more housing, or this suggests slightly more housing stability versus the other options, which make up about 24% of respondents. Respondents were also asked where they had been living 6 months prior to the survey, and we do not see too much change from the current from where they're currently living to 6 months prior. And again, we see rather stable responses for the top two categories. New this year, we added in the answer stem for in custody of a parish at a jail and received about 1% of respondents who that was applicable for. Here we have the number of adults and children living in the respondent's house at the time of the survey. So I know there's a lot happening here, but so looking at the figure on the left, each bar represents how many respondents, or the percentage of respondents who said that they had that many adults living in their households. So 51% of respondents said that they were the only adult living in their households. And then on the right, we have each percentage for how many children were living in the household at the time of the survey. And 72% of respondents said that they did not have any children living with them. So the average number of adults living in the household was 2, and the average number of children living in the household was 1. If respondents were currently living somewhere, they were asked how many bedrooms were in the place they were currently housed. 88% of respondents fall between 1 and 3 bedrooms, and around 10% have 4 or more bedrooms, and 3% have a single room or studio. This slide shows respondents' estimated number of places lived in the past year. 66% of respondents stayed in one place over the past year. And Brandy, Brandy commented when she looked at this figure for some context, that 29% of respondents lived in 2 or more places can suggest a 29% at risk of housing instability. So the pattern of prior relocation can suggest housing instability. Respondents were also asked 2 different questions represented on this slide. So the figure represents how long respondents had been at their current residence. We see that 62% have been at their current residence for more than a year. A separate question was asked if respondents had to move in the past 3 years due to not being able to afford their home, and 22% of respondents did say that they had to move due to finances. And again, just bringing in Brandy's comment for context, the duration at current residence can also suggest housing instability. That 35% of respondents lived at their current residence less than a year can suggest a risk of housing instability. Respondents were asked to estimate how many nights in the past year they spent homeless or without a place to sleep. So looking at the figure, we see that around 15% of respondents spent at least 1 night homeless in the past year, and the majority at 85% did not experience this issue. When asked if in the past 12 months there was any difficulty obtaining housing, around 20% of respondents did have issues obtaining housing in the past year. We pulled this figure from 2019 and found that that sample size had around 77% of respondents say no. Next, we asked about barriers to obtaining or remaining in housing. So less than half, 43%, selected that they didn't have any problems. We do see that a quarter said that they could not find affordable housing, and over 20% said that they did not have enough money for the deposit. When looking at the renter mortgage contribution paid out of pocket, respondents' answers are really spread out. This is a write-in question, meaning respondents could write in whatever their out-of-pocket contribution was. And we can see that the top 2 categories are tied at 22%. with none, and then $500 to $749. Finally, respondents were asked if they had any difficulty in paying rent or mortgage. As we can see, respondents are pretty much equally split in half, with 48% reporting difficulty in paying for their rent or mortgage. Any particular questions or discussion points on the housing specific findings?
Again, feel free to raise your hand or unmute yourself and speak up.
Just have a question about, where did you, or do you have the statistics on, where did you find it was the hardest area in Louisiana? Was it rural or, in the metropolitan area where people had the problems with paying the rent and the deposit?
That's a great question, Shirley. We haven't broken down the data in that way, but we are going to be providing back the full data set to OPH. And so I think there are a few different ways that we can look at it, and we can certainly look at that particular question. I think it's a great one. Thank you for bringing it up.
Great. And other questions related to the housing data or comments? I don't see any hands. I don't hear anybody speaking.
Brandy, this is Rainey.
Oh, go ahead,
there-
Rainey.
Hi, was there any, and this might come out in the full release of the data, but to look at any sort of correlation between those clients who are accessing supportive housing programs or, participating in some sort of program as it relates to the responses that you're getting in terms of affordability, whether or not they're renters versus owners, like some of that in connection with what Shirley has also brought out, I think is a way for us, at least on the legal landscape, to figure out if there's some way in which we might intervene to assist with some of the issues that they're encountering.
And Nora, I'm going to guess you're going to give the same answer to Rainey, but feel free to repeat it.
Oh no, these are really great points, and thank you all for bringing them up. I think as much as we can be thinking about how to use the data and triangulate some of these responses, and Brandy and Erica, feel free to jump in, but my understanding is once we provide the data set back to you all, some of that work starts to happen where you're looking across different data sets and trying to overlap in that way. Is that correct?
And that's why I'm also taking these detailed notes. Rainey's suggestions are excellent, so we're making a note of it for future sub-analysis. Thank you both. Other questions or comments on housing? Then back to Alexis and Nora.
Great. So now we're going to be moving into barriers to receiving care. So on this slide, we have the top 5 highest ranked services needed with 2021 data on the left. And we also wanted the opportunity to compare that with 2019 data. So we have that on the right. So in general, you can see that the top 2 categories are still dental care and primary medical care, although the order has been switched for those 2. And in 2021, we see that eye care and emergency housing services come into the top 5 categories in 2021. When we look at the highest ranked gaps in services, you'll see that housing services are 2 of the categories in the top 5, similar to 2019. And in fact, these lists are pretty similar, but emergency housing services has come into the top 2 in 2021. And I think we can think about some of the reasons over the past year that this might have happened. In the next 3 figures, we're going to show need and receipt of core services. And here we have the need and receipt of core medical services. This is another one of those figures where there's a lot going on, but the idea is really the same as that medical services diagram that we had shown earlier. That darkest blue, that's really where you want to keep your eye. That furthest right represents those gaps in services. So people who needed but didn't receive the services. And here you can see that dental care, which is that top row, and eye care are the 2 top categories where we see gaps, with 21% for eye care and 26% needing but not receiving care for dental care. For core supportive services, emergency financial assistance and housing assistance represent the largest gaps in services in terms of people who needed but didn't receive the service, each at 17%. And then in terms of gaps for housing services, we see again that emergency housing services is where the biggest gap lay. Any questions on the results or comments on barriers to care? I think one other thing that I might lift up, and Brandy, I know that you had noted this in the presentation, is that we did just present the top 5 services and the top 5 gaps in services. When we provide the full report, you'll see the full list ranked fully, and so that might be a different way to look at some of these categories as well.
And I know that many participants in this session this morning have seen prior needs assessment reports. I'm curious if anybody is being surprised by these findings or if these results are what they might have expected. If the results are reflecting the trends and changes over time as you might have expected.
This is Rainey again. I'm just kind of looking at the core medical services. Obviously, the supportive services. Obviously, the legal services piece is what's of interest to me. And so, yeah, the 13% who did receive and the 8% that did not receive. I think this might be the first time I've seen something quantified that kind of helps me get a sense of what's happening statewide. So this is good for us. I guess I would be interested and probably get with you all to look at how this was collected and how we might be able to use that going forward in the work that we're doing. But I do appreciate having that pulled out, given that it was, you know, a relatively small sample, but a decent sample of folks who responded to legal services, which frequently goes unanswered in these assessments. And so this is very helpful for us. So I appreciate that.
Thank you. We're happy to receive that feedback. And just as you described, we want this data to be useful to everyone. All right, if everyone else is quiet, if there's no other questions or comments at this time, Nora, I'll pass the mic back to you.
Thanks, Brandy. So now we're just going to take a closer look at the unemployment findings from the needs assessment. So first up, we asked about the employment status of those who responded to the survey. The highest response was disabled at 36%, and then followed by full-time employment at 25%, and then unemployment at 23%. Now looking at sources of income respondents reported having, we have very many options selected. And I think that this corresponds to the previous slide of employment status. Wages are the highest category at 35%, but followed by many different benefits that are available through state and federal programs. Respondents were asked about their household income in the month prior to the survey. Looking at responses, this figure is pretty spread out. We have 23% of respondents selecting no income, and then 20% indicating that they have income more than $2,000. The largest category is $501 to $1,000 at 29%. And then we have another view of the same figure from the previous slide. We just wanted to show that over half had an income of less than $1,000. So you see that with the largest segment of the pie chart, the darkest blue, and then over 1,000 at 43%. Any questions on findings focused on unemployment?
The income is monthly, that $1,000
Yes.
range. Okay.
And we welcome other questions or comments on that. And everybody's quiet, so back to you, Alexis.
Awesome. I will go ahead and pass the baton to Noor.
Great, thanks, Alexis. So in this section, we're going to be going over focusing more on the New Orleans report in particular. And Shirley, I'm just thinking about the question you asked earlier around housing, and I know this isn't exactly breaking down rural versus metropolitan, but maybe a way to think of that as a little bit of a proxy for those housing figures that we're going to show later on. So moving into the background characteristics for New Orleans. Again, this is pretty similar to what we would expect to see. Similar to the statewide report, majority of respondents identified as male, Black, and as older adults. We do see higher percentages, though, of respondents identifying as Latino, Latina, Latinx, Hispanic, and as a person of trans experience when we compare it to the statewide report. We also see similar levels of educational attainment in New Orleans, although there is a bit of a shift to a higher percentage of people with a bachelor's degree or higher in New Orleans than what we see statewide. We see higher percentages of people reporting that they spent at least one night homeless or without a place to sleep. We have roughly 20% of people in New Orleans reporting one or more days in the prior month, compared to 14 in the statewide report. The success and uptake of the U equals U campaign is also very evident in New Orleans. So here, 83% of respondents knew that undetectable equals untransmittable in New Orleans. And you can compare that to 78%, which was still successful in the statewide report, but a bit of a higher percentage here. We also have a higher percentage of people reporting a detectable viral load in New Orleans than what we see in the statewide report. We have 13% in New Orleans compared to 7% is what we saw statewide. In terms of insurance, although we still have the majority reporting some type of insurance, this is a smaller percentage than what we saw statewide. So here we have 78%. For reference, the statewide report, we saw 85% reporting some sort of insurance coverage. We also see a shift in reporting difficulties in paying for HIV-related healthcare costs. Here you can see that the majority of respondents report some sort of difficulty, from a little bit difficult, that's that second column, to almost a quarter saying that it's completely impossible, all the way on the right. And in terms of problems, when asked, respondents had some of the same types of problems that we mentioned earlier in terms of paying bills and paying for medication. In terms of reasons why people may not have received needed medical care, the reasons are predominantly logistical. So they couldn't get transportation, they couldn't get an appointment. We also see a notable percentage of people reporting that they were worried about COVID-19 in New Orleans. The reasons for mental health care here, again, are different than what we saw in the statewide report, where we really saw more a question of access, people not really knowing where they might be able to receive services. Here, we're looking at these logistical barriers like transportation. In terms of interest in psychosocial support, Alexis mentioned that counseling was the #1 selected category for the statewide report. Here we see it social activities and support group are where people are showing the most interest. And again, we have these highest ranked services needed, looking at New Orleans in particular, and we have different categories compared to the statewide report, which might suggest access and difference in needed services by region. One thing that's important to note, and I was speaking to this a bit earlier, again, is that we're just showing the top 5 categories here, but housing related services did appear 3 times in the top 10 needs in the full report, so that's something to note. And this need around housing services is more apparent when we move to the next slide, where we look at gaps in services, and you can see that the top 3 of the top 5 in 2021 are around housing, with emergency housing services, housing assistance, and someone to help affordable housing finding their way in the top 5. And again, seeing dental care be a challenge for gaps of services here. In terms of COVID-related questions, perhaps the most important takeaway is on the right-hand side of the slide, where again, we see that the majority of people report having an HIV-related medical care visit via telehealth in the past 12 months. And we see similar percentages in terms of diagnosis of COVID-19 and also barriers around work, inability to work in the past 12 months related to COVID-19. So with that, we wanted to, again, provide the opportunity for people to ask any questions or any comments that they might have on the New Orleans specific findings.
And I do not yet see any hands raised. I do not yet see any comments in the chat box. Again, if you've got comments or questions, you're welcome to unmute and speak up. Or if you're all quiet, then we'll move on to the next section.
Right, thanks, Brandy. So now we're going to focus on another metropolitan area in Louisiana. We're going to focus on Baton Rouge. So we have a table showing background characteristics for 2021 respondents, particularly in just in Baton Rouge, and how they identified their gender, race, and age. So findings in Baton Rouge were pretty different from the statewide and New Orleans reports in terms of background characteristics. We have close to half and half of respondents who identified as male and female. In other parishes, we have found respondents to be majority male. And looking back, this is not necessarily surprising for this particular survey, as in 2019, we did actually have 55% of respondents identify as female and only 44% identify as male. So, and looking at the state surveillance data, males are the majority of persons living with HIV in Baton Rouge. So this might be a little bit of survey bias, just the agencies that we use to collect data. Looking at race, Baton Rouge respondents were 92% identified as Black at a percentage of around 92%. And this matches the statewide and New Orleans report in being the majority. But Baton Rouge definitely has a higher percentage reported, but all do have the majority. With the age groups, we see similar findings to the statewide and New Orleans reports, or findings that it tends to be an older population, with the majority falling between 45 and 64 years of age. 1% of people in Baton Rouge, of respondents in Baton Rouge, identified as Latino, Latina, Latinx, or Hispanic, and 8% identified as a person of trans experience. Here we have the highest level of school completed by respondents. These numbers are really similar to the statewide and New Orleans reports, but Baton Rouge does have a higher percentage indicating high school diplomas or GED equivalent. That was 42% in the statewide report versus the 50% that we see, 50% that we see here. Now, we have nights spent homeless or without a place to sleep in the past 12 months. So we have numbers very similar to the statewide report, but a larger majority do indicate that they have not been homeless in the past year. This percent was only at 85% in the statewide report findings versus the 91% that we see here. Looking at if respondents know that U equals U, we have a slightly lower percentage than the statewide results. So again, statewide had 78%, and then New Orleans had closer to 82%. So this suggests that Baton Rouge is not as exposed to the U equals U campaign as NOLA and possibly other regions in Louisiana. And then here we have pooled health insurance status, and we see a larger percentage of Baton Rouge respondents are insured as compared to the statewide sample. That's only at 85% of respondents having insurance. Looking at reasons for not receiving needed mental and medical care, we have some differences from the statewide findings. So Baton Rouge respondents cited not wanting anyone to know that they were living with HIV as their top reason for not receiving their needed mental health care. And this was not a top reason in the statewide report. So that is very interesting. And then interestingly as well, transportation was a lot less of a barrier in Baton Rouge as opposed to the other regions, suggesting that reasons that they're not getting care is not as much of a logistical issue in Baton Rouge. Looking at the interest in psychosocial support, we see that the high school education and GED programs went up a little bit as compared to the other regions. It's at 15%, suggesting that there's more of an interest in Baton Rouge than elsewhere. We do see that counseling and support groups are still the top categories, which reflect the statewide findings as well. And then here we have the highest ranked services needed. We see that dental care is #1, which reflects the statewide results. In the top 4 ranked services needed here are included in the top five categories in the statewide findings. But it's interesting to compare the 2021 findings to the 2019 findings for Baton Rouge, as we see that dental and eye care were highly ranked services, but now they are the top ranked services. Here we have the highest ranked gaps in services for Baton Rouge. So these rankings are the same as the statewide report, but with slightly different percentages. This slide is useful to see gaps in services from 2019 versus 2021. We see that dental care was not on the list in 2019, but is now #1. Emergency housing services, eye care, and housing assistance were both in the top 5 in 2019 and maintained a high status in 2021, but with a slightly different order. Do we have any questions on Baton Rouge specific findings?
I don't see any hands. I don't see any chats in the box. I don't see anybody unmuting themselves.
All right. Then, I mean, that was the end of our presentation. Thank you guys so much for joining us today. And if we have any discussions or questions on maybe something we didn't go over, or if y'all wanted to just have a minute to discuss the overall presentation, I think this would be a wonderful time for that as well. I'll go ahead and stop sharing my screen.
And as Erica said at the beginning, I again want to thank everybody for all of your support throughout this process. And we're curious about your reactions. We know that this report and the data collection really took an extra lift this time. And we're wondering, how do you feel now that you've seen the results?
As you guys continue to think on that, I wanted to thank you, Alexis and Nora, for your wonderful presentation. I wanted to pass the mic to Jessica Fridge, our STD HIV hepatitis program surveillance manager, as she has a data resource announcement. Jessica, are you there?
There we go. I'm unmuted.
There we go.
Hi,
Okay.
everybody. Okay, so I'm going to make this really fast. We wanted to make sure that everybody was aware that we have completely revamped can you all see my screen?
We can see your Citrix screen, but that's all.
Not how about that one? There we go. So we have completely revamped all of our fact sheets. And what we released at the end of last week that are available to everybody, they're on the website. We now have 10 profiles. So there is a Louisiana profile, and then there is a profile for each of the 9 public health regions. They all follow the same pattern. So this is the Louisiana one. The first page is the same for all. It shares a little bit about like what data were included, what are the data sources, SHIP's new vision and mission are included here. We have some data definitions about like what is a count, what is a percent, what is a rate. We've got some disclaimers at the bottom, and then like where can you go find these data? And then we've got on the Louisiana one, there is a 2-page demographic summary of Louisiana. So this is not disease related. This is like, how big is the population? How much of it is rural? What percent of teen birth rate is there? What is the infant mortality rate of the area? What is the race ethnicity? What is the gender breakdown? Whatever that might be, age and sex, education, socioeconomic status, health insurance, health indicators. This then repeats for each individual region. So for region 2, these data are for only region 2, and they give a lot of context then for the data that you're about to see. And then there are disease specific infographic fact sheets. So you can print out just the HIV one, or you can print out all of them. So they all follow the same order. There is HIV, which includes at the bottom of HIV, you can see care data like engagement in care, viral suppression. Then it's followed by primary and secondary syphilis, which includes syphilis treatment information. Then it's followed by congenital syphilis, which again includes treatment information, followed by gonorrhea, which includes screening and treatment information, followed by chlamydia, which includes screening and treatment information, followed by acute hepatitis B, then chronic hepatitis B, then acute hepatitis C, then chronic hepatitis C. So for this, and then there's a list of references. So for the state, all 9 regions, all of that is now available. So the Baton Rouge one I pulled up as well as an example is right here. Again, the first 2 pages are the same, but then when you get to the demographic page, these are the demographics specific to region 2. And then all of the fact sheets are then specific to region 2. So all of that is available. Let us know if you have any questions, comments, concerns, and hopefully you all will be good advocates for sharing these data far and wide. And that's all I had.
Thank you, Jessica, and thank you, Brandy. I believe Brandy just placed those links to these data in the chat so you can find them. We can go back to questions and answers or comments about the needs assessment presentation. But I just wanted to say thank you again for joining us this morning. Please stay on if you would like to continue to discuss. We thank all of the agencies and the clients that help spread the word to collect surveys during this very challenging time. And then in 2023, we'll ask your assistance again as we continue this important data collection effort. And we look forward to your collaboration.